I want to share with you, this is really from kind of the treasure files of Dr. Odeblad. This appears to not have been published in peer review, although it was published in a bulletin for the Australian organization. So basically, it shows that the number and the ratio of different crypts change as the woman ages. And the S crypts are the most affected. So in this woman, this is a woman who went through her entire life without pregnancy, but she also did not use any chemical contraception. And you can see how, at early age, about over 80% of the cervix is made up of crypts. Over 60% of them were S crypts. And then as she ages, you can see that the total number of crypts decrease, but most proportionately the S crypts. This is a woman who had 4 pregnancies, but she also did not use any chemical contraception. And you can see here how the 4 pregnancies essentially prolonged the life, extended the life, if you will, of the crypts. And then shortly after, maybe 4 years or so after that last pregnancy, then the numbers of crypts started to go down. And then you have a woman who was never pregnant, but used oral contraception for 10 years. And you can see here at a very relatively young age, around 17, 18 years old, for 10 years. You can see the rapid decrease in the S crypts. And if you look at these graphs side by side, then it's more stark. So you can see the no pregnancy, no chemical contraception. Here's the woman who was pregnant. If you just pick an age, like say 35, you can see that about 30% of the cervix is made up of S crypts. And a woman who was pregnant, she still had 60% of her cervix made up of S crypts at the age of 35. And then compare that to the woman who was on hormonal contraception for 10 years. You can look at the age of 30, about 40% of the cervix is made up of S crypts. And here in the woman with contraception, about 20%. So it's very significant.